Today I'd like to talk about thyroid hormone. Low thyroid hormone can lead to several different symptoms, including fatigue, weight gain, foggy thinking, hair and nail changes, skin changes, and it's generally associated with aging, although I do see some young people who have problems from time to time. People who have arthritic-like conditions, chronic fatigue syndrome, and even fibromyalgia also seem to benefit from supplementing the thyroid. Normal thyroid physiology, your brain produces TSH, or thyroid stimulating hormone, which causes your thyroid to produce T4, which is excreted out into the body, and the body converts the T4 to T3. T3 is responsible for all the actions of the thyroid in the body, which affects metabolism and weight and cholesterol levels and cardiovascular status. There's been studies showing that the most potent antidepressant on the market is to give patients free T3, or the T3 hormone. This works far better than most all the other antidepressants on the market. So the consternation and the problem comes because I have several patients that come to me saying, "Doctor, I've had my thyroid checked and my previous physician told me it was normal." Well, the problem is with anything in medicine, there's normal ranges, and that goes from a higher level to a lower level, and most everyone who has their levels checked fall in this range. The problem is you can be in the normal low range and have symptoms that are only going to be better once you've been supplemented with thyroid hormone. I recommend using free T3 in combination with free T4 in a medication called Armour Thyroid or Westhroid or Naturethroid. And the reasoning there is if you use just Synthroid, which is branded, or levothyroxine, which is all T4, your body's not efficient in converting T4 to T3, so you may be taking an adequate dose of T4 but still have a very low level of T3. And I know this sounds all very complicated, and I'm trying not to be too complicated with the discussion, but it is very important that if you're having any of those symptoms, I would like for you to go ahead and schedule an appointment where we can do an evaluation, a physical examination and blood work, and we can get to the root of your problem. And I wouldn't be a bit surprised if supplementing you with Armour Thyroid or Naturethroid or Westhroid wouldn't be one of the best ways we can to help you feel better. This is Dr. David Jayne, and if you'd like to schedule an appointment, you can call my office at 405-330-0038.